Good afternoon to everybody. Ellen Ayurvedic PG Entrance Coaching Center, Salimnagar, Hyderabad. Today's topic is karkatasrungi, which is easily available, having excellent multifold actions applicable in day-to-day or in our daily routine life where we are facing problems. What are the important problems? What is what? And how far it is applicable? Whether we can use directly this powder or not. In different combinations, how to use it, we will come to know. Let us see. This karkatasrungi is Pistacia antigerrima, belongs to family Anacardiaceae. Belongs to family Anacardiaceae. What is the part? Suppose if you are, first of all, when a plant name is given, which part is used, what is what, you will come to know. The part used is gall in this case, is it not? So, this plant easily available in dry samples. If you are watching this plant material in dry sample shops, it is where Ayurvedic raw materials are sold, there you can get this plant. I think I want to say the basic difference between allopathy and Ayurveda. In case of allopathy, is nothing but totally a chemistry, an artificial system. Today they are depending upon the natural plants and extracting the compounds, and again they are giving the finishing and using as medicines. It is a scientific system, section in the sense. In the system of Ayurveda also, the raw material first of all has to be identified plant-wise, then part-wise, then its dose has to be fixed, its form has to be fixed. So these are the 4 points. What is the identification of the plant, first point. Then identification of the part used. Identification of the part used pharmacognostically. Then form of the plant material what we are using. Form of the plant material what we are using. So these points you have to consider before going to use any material as aushadha, as dravya. That is very, very important. So in this case, the part which is used is nothing but the part which is used is nothing but the gall. Is it not? According to Charaka, it comes under kasagara dasemani. Note this point. What is kasagara dasemani? In respiratory diseases, especially in cough. See, he has mentioned kasa clearly in Charaka Sutrasana, 4th chapter. So whether it is dry cough or wet cough is the next question. Different types are there, is it not? Anyhow, in general, in kasa, in respiratory diseases, this can be used. So kasa dasemani, hicca nigrana dasemani, hiccough conditions, even in the case of hiccough conditions also, this can be given. Then most important, one more point is there pertaining to drug action. Sukra janana dasemani. So this powder, when taken with milk, having the capacity to promote the quality of the semen. Semen you say, sperm you say, you got the point. Semen or sperms. So having the capacity to promote the sperm count in the system. It is an excellent drug which is easily available. Today, infertility or having no progeny or trials for progeny is linked with lakhs of rupees today. So there are different steps. Blindly, an young couple should not go for hasty decisions. They should not take any hasty decisions. They will ruin the life. This is not in your lifestyle. In marital life, sexual life is a part and parcel of the marital life, and you have to consider it in a positive way. This is linked with your mind or manas, whatever you say. Is it not? Hasty decision. See, progeny is not there even after complete 3 years or 4 years. You need not blast your mind. Don't be in frustration. There are number of good natural remedies are there. Let us try. Is it not? So, still the span, till the reasonable age limit, you have to try it to have the sperm count. So, you have to take the quality diet. You have to avoid the stress and strain. Stress, you have to avoid 3 things in your life if you want to be happy. Stress, strain and pain. If you are not having the stress, strain, pain, all the vata, pitta, kapha, doshas will be in balanced condition. But anyhow, come to our point. So not to have any hasty decision. If you are using this karkatasrungi, churna with milk regularly, it is having the capacity to promote the sperms in the system. How, what is what, again it is a different science. See, it is not possible to investigate based on totally on the clinical trials, because see, in the system of Ayurveda, when we are using a medicines in the sense based on the classical reference we are using, try to understand. In the system of Ayurveda, if you are using medicines in the sense, we are using based on the classical reference. Today budget is available, central government encouraging, state government encouraging, private sectors encouraging. You can go for the clinical trials by sparing crores of rupees, nothing wrong in that. But it requires money, So for everything, if you require a clinical trial, is it possible to use the medicines? Charaka has mentioned 500 drugs in a just manner. So you mean to say clinical trial mandatory? At what level mandatory? How in the system of Ayurveda these drugs have been used? How the central government offering or projecting different projects having different registered, recognized research, scientific research organizations in India, in the world? You got the point? So it is not one man's answer. In older days, how it is run in the same manner. Today, even today, we are running the concept. But you can go for clinical trials. Nothing wrong in that. Already proved drugs. These drugs have been proved. Even National Medical Council, Ayush Department clearly mentioned that maximum more than 600 to 700 drugs for utilization. See, so many, every year thousands of doctors, graduates in system of Ayurveda coming out. So you mean to say to use the system of drugs? So do you require clinical trials? Of course, you require clinical trials for unknown drugs, toxic drugs. If you are using a new drug, you require research. But doing research on a particular plant, you can do in the sense, it at different forms, or in different forms you can do research, number one, or in different doses you can see, or when different species are there you can see. There are credentials are there. Blindly, people will question any clinical trials over. What is the percentage of the result? Can you give guarantee and warranty? What is this? Nothing wrong in asking from your side. But how to answer these questions? Because Ayurveda totally is not today's. Try to understand. Ayurveda is not today's. It is there for the past many generations. It was there. It was transmitted. The knowledge was transmitted. And every year the projects going on. See, what is 20th century? How many 19th century's work is there? You are in 20th century. So you try to think. Try to understand how many centuries you require to complete the work of Ayurveda. My question to the public, to the university, to the universe. How many years you require? How many centuries you require? In 1 century, can you conclude the work of Ayurveda is over? That is why a medical college is different, a research center is different, and a registered or recognized research centers are different. State government research centers are different, central government research centers are different. See, every research center having some credentials, some criteria. Based on the criteria, according to their availability, according to the terms and conditions, they will conduct the clinical trials. In general, research is a two types. Conducting the clinical trials in a controlled climate, controlled and uncontrolled climate. Controlled climate, uncontrolled climate. Is it not? So many factors are there. When reference is there, nothing wrong in using the drugs. When reference is there, nothing wrong in using the things. Okay, let us come to our point. Just you take this powder, karkatasrungi churna with kshira. Karkatasrungi churna with kshira is an excellent aphrodisiac drug, and it promote the sperm count in the system. Now you have to use it practically. If you are using, you will come to know. So that is why Kalaha Paranama Hetu. What is Kalaha Paranama Hetu? Time is transformation. Without transformation of time, nothing is possible. Without transformation of time, nothing is possible. You have to give some weightage to the system, weightage to the body, weightage to the drug. So without knowing all these things, blindly you cannot comment anything. Okay, what is the chemistry behind this plant for its actions? Let us see. What is the chemistry here? Chemistry, you mean to say chemistry means chemical compounds? Yes, you are right, no doubt in that. But what is our chemistry? Let us see. It is having tikta kashaya rasa, Katuvipaka and Ushnavirya. See, Kinchit Rasena Kurte, Viryam Vipakam, Tadhaparam Prabhava and Chai. It's a beautiful concept given on Samhita Kala. It is a beautiful concept given in Samhita Kala. Is it not? What is a? Some drugs works by Rasa, some by Virya, some by Vipaka, some by Prabhava, some by nature. Is it not naturally in the sense? Let us see. So now I have told you it's chemistry, Tikta Kashaya Rasa, Katavipaka and Ushnavirya. What is the part used is Gall, Kosa in the sense. See, what are the, generally it is applicable in Vatajanya Vikaras and Kapajanya Vikaras. See, I will tell you one thing. Whatever may be the disease, today the reason is food intake, improper quality or proper quality, improper quantity, proper quantity. Two things. And then that is following the Nitra, Ahara and Brahmacharya. Following the Nitra, Ahara, Brahmacharya, Trayapasambhaka. These are the important factors behind your disease. If you are able to maintain the Nitra, Ahara and Brahmacharya, automatically the problem will come out. Okay, let us see. It's come to main actions. Let us see. Now, just you take this one, take the karkatasrungi churna, mix with a little bit oil, add and take it. It is extremely useful in case of dry Vata Jakasa. See, Vata Jakasa will be there, Pitta Jakasa will be there, Kapha Jakasa will be there. That means there, what is the Vata Jakasa, what is the Pitta Jakasa, what is the Kapha Jakasa, their dominance of the Vata Lashnas will be there, Vata Jakasa, Pitta Lashnas will be there, Kapha Lashnas will be there. You have to trace it. That is why, while speaking to the patient, the history is more important. Without knowing the history blindly, you cannot give it. Once, at least if you are seeing once or twice, later on you can continue treatment. Nothing wrong in that. But so now, just to take the powder, mix it with a little bit oil and take it. So it is useful in case of Vata Jakasa. In case of any vomiting sensation, take Karkatasrungi churna and musta powder. Musta means Cyprus rotundus powder. It is available in market today. A lot of awareness is there in the system of Ayurveda. Even today many people without qualification in modern science, we require some qualification to run a medical stores. But in the system of Ayurveda also the criteria is there. People, because of its importance, by knowing the value, so many people now they are selling almost all the powders in 100 grams packets, 50 grams packets. See the difference, how doctors prescribing, what is the next issue. What I mean to say, a lot of awareness is there. Drugs are easily available today. So you take this powder, mix it with musta powder, take regularly. It will control the vomiting sensation. It's very mandatory. Now, take the karkatasrungi churna with kshira or milk regularly. It will promote the sperm count. According to Ayurveda, in 2nd century, it was confirmed as one of the best and important drug in Sukra Chaya Janita Vikaras or Sukra Nasa Janita Vikaras. Sukra Nasa Janita Vikaras. What I mean to say, in case of clavia, impotency, and where progeny is lacking, where sperm count is very weak, in such conditions, this churna can be given. Of course, by using this, different combinations are there. See, try to understand, every drug will be having multifold actions with one main action. Every drug will be having one multifold action along with one main action. So, we are giving importance to the multifold action drugs required, or we are giving importance to a single drug alone itself. According to situation or according to requirement, according to availability, you have to consider the case. So, now you came to know. I think in our Ellen Ayurvedic PG Entrance Coaching Center series, in previous episodes, you might have seen what is the shape of the karkatasrungi, what already we have shown you. Now observe and take the material, you can use it, nothing wrong with that. But remember, whatever drug you are using under the doctor's supervision, you have to use it. In nutshell, this is about karkatasrungi. So now, see, blindly we cannot speak today in front of all the people. We cannot speak blindly. I will tell you a beautiful reference. You see the reference. So in Sodala Nigantu, it was Sodala Nigantu, Bhav Prakasha Nigantu. It is very, very clear arrangement. It is applicable in Swasa, Swasa urdhvavata trut kasa hikka aruchi vamin haret. I will read once again. Swasa urdhvavata trut kasa hikka aruchi vamin haret. In dry cough, if you are giving this powder with taila, it is excellently useful in dry cough. It is mentioned in Charaka Samhita, Chikitsasthana in 2nd century almost. See, today you are in 20th century. In Ashtanga Sangraha, Uttarakanda, Uttarasthana, it is clearly mentioned, take this powder with Kshira, it is a Sukravardhaka Dravya, Vajikarana Dravya. Sukravardhaka Dravya or Vajikarana Dravya. It is the importance. Now you can understand what is in our previous classes you have seen, and today we are telling the applications of this drug. Applications of this drug. It is extremely easily available drug. Okay, in case of any doubts, you can contact Dr. Simhadri, Ellen Ayurvedic PG Entrance Coaching Center, Salimnagar, Hyderabad, 9014141722 for further classes. We are taking classes for interested candidates, all the pharma people, medical representatives, those who wants to have the fundamentals also of Ayurveda. This will help you. Our organization will help you to an extent. Up to which extent you want to reach, up to that extent you can reach by following the classes or observe the, see in our episodes we are showing the dry sample, we are showing the wet sample, and we are telling the fundamental characters to identify the things and their applications also. But anything, whatever you are doing under doctor's supervision, you are supposed to do. Thank you. Today's class is over about karkatasrungi. Right. Thank you.